Health Insurance Open Enrollment Get Answers is a production of UNC-TV in association with the North Carolina Hospital Association.
Now, you may not be able to completely predict all of your upcoming healthcare costs, but there are ways to prepare for some issues. Now, one way to plan for healthcare costs is to open a health savings account or plan. You can think of this like a personal savings account that you have at your bank that holds money that is set aside that can be used to pay for healthcare costs down the road. Here's a quick video that goes over 3 of the types of health planning accounts.
There are several types of health savings accounts. First, the flexible spending account. A flexible spending account is set up through your employer plan, and it can allow you to set aside pre-tax dollars for certain health and dependent care needs. For example, the money can be used to pay for deductibles, prescription copays, and other treatments not covered by your insurance. A big downside for many, though, whatever you don't use by the end of your company's benefit year will be or can be forfeited. You need to check with your employer's Human Resources Department for specifics on their FSA. They can provide a list of FSA qualified costs that you can purchase directly or be reimbursed for. A health savings account, or HSA, is a tax-preferred savings account available to those enrolled in health plans. Employers and employees are allowed to contribute to them. HSAs allow you to set aside tax-free dollars to pay for routine, out-of-pocket health expenses. You also pay no federal taxes on interest earned by your HSA as long as you use the money to pay for eligible medical expenses as defined by the IRS. Dental and vision are included. Unlike an FSA, an HSA funds roll over annually and accumulate even if an employee changes jobs. The accumulated funds can be removed for non-eligible expenses, but then will be subject to federal income tax and a 20% penalty. Once an individual qualifies for Medicare, these accumulated funds can still be used tax-free for medical expenses Medicare doesn't cover, or they can be used like an IRA or 401k. A Health Reimbursement Account, or HRA, is an employer-funded group health plan for which employees are reimbursed tax-free for qualified medical expenses up to a fixed dollar amount per year. Unused amounts may be rolled over to be used in the next year. The employer funds and owns the account. Health reimbursement accounts are often called health reimbursement arrangements.
Now, the video talks about the ability for the health savings account to roll over to the next year. Now, is this true for all types of plans, Mary?
It's not. It's only applicable to the health savings account. The FSA, the flexible savings account, must be used before the end of the year. A health savings account does have to be tied to a specific type of plan, generally a consumer-directed health plan or a high-deductible health plan. We offer one bronze plan that is HSA eligible, health savings account eligible, and one bronze plan that is not. I know the rules for employer groups and what they offer can be different.
Right, and so you could see a scenario where as long as there's a deductible for at least $1,300 for an individual, that could be a plan that's eligible for an HSA. And so within that context, it'd also be important to know if your employer is contributing to that and the tax advantages of doing so. Those plans usually have lower premiums, and so it provides the opportunity for individuals to contribute to that account and kind of stock away savings for a rainy day, so to speak, because it can be used in future years. So you can take that money and contribute it before taxes, and it can grow in that account tax-free, and then it can be spent in future years tax-free as well. And so there are strong tax incentives to help make that plan and make that money as efficient as possible.
So if I were considering doing this, what would be some of the key points you would suggest to me in order to find out what would work best for me?
Well, I would look at how much money you're saving by participating in the high deductible plan, and then consider how much you might be able to contribute. Look at some of the costs that you might expect to incur as you seek out care. And try to put away enough to cover those costs. And then those years where you're not spending that can be saved, and it can grow year to year so that you have it in the future.
Health Insurance Open Enrollment Get Answers is a production of UNC-TV in association with the North Carolina Hospital Association.